Welcome to Caregiver SOS On Air, presented by the WellMed Charitable Foundation, with nationally known gerontologist Carol Zernial and award-winning veteran broadcaster Ron Aaron. This program provides health, wellness, and other information for caregivers who are vital to the health and well-being of so many people across our country. And now, here are your hosts, Ron Aaron and Carol Zernial.
Well, thank you so much for joining us today on the award-winning Caregiver SOS On Air. I'm Ron Aaron. Carol Zernial, our co-host, is here. She's got a master's degree in social gerontology, over 30 years' experience in that field. She's co-chair of the Raise Family Caregiving Advisory Council, and Carol serves as executive director of the WellMed Charitable Foundation. And Carol, we're going to be talking with Neal Shaw, who specializes in trying to help older folks and caregivers, and talk about a growth industry.
Yeah, we're not going to run out of older people or caregivers anytime soon. It's been a lifelong career for me as well. But more importantly, Neal's going to talk to us a little bit about the lack of training that caregivers receive. And, on the Raise Council at the federal level, as we're talking about planning for the future, the issue of caregiver training is a hot topic.
Well, let's take a moment and introduce our special guest today. And Neal Shaw talks about how little training or support is given to family caregivers when they suddenly become the doctor, the nurse at home for someone diagnosed with dementia or cancer, and how there's an opportunity and a societal responsibility to provide better training and support for them. He's a healthcare researcher focused on caregiving for the aging population. Neal is an NIH-funded principal investigator on the Yaya Guide AI for Care. And if you Google Care Yaya, a whole bunch of stuff pops up. And Neal, we appreciate you joining us.
Thanks so much for having me. I'm very excited to talk about this topic.
What is it that attracted you to this topic? Because you're relatively young.
Yes, thanks for the question. I actually, I became a caregiver. I became a caregiver through dementia and through cancer in my early 30s. And prior to that, I was running an investment fund in New York City. And, this was like really eye-opening to me. But my kind of personal background is, I came out of school and went to work on Wall Street. I was pretty good at it and very rapidly rose up and became a partner at a multi-billion-dollar fund when I was 27. And by my early 30s, I was running my own fund, which I grew pretty fast from 10 million to 250 million under management. And at the same time, I had become a caregiver for my grandfather through dementia. And, I am from a very modest background family, so everybody relied on me to figure this out. Frankly, unfortunately, I figured out how difficult the care industry is and, the tremendous pressure on us to figure out his care. My mom ended up leaving her career to do it full time, which was heartbreaking in a variety of ways. After he passed, she was never able to reenter the workforce. And at the time, I was still running my fund, and I just became obsessed with caregiving. I was like, this is unbelievable challenge when it happens to your family, and there's minimal resources or support. So what can I do to improve this? Unfortunately, at the peak of my fund, my wife became severely ill and went through a multi-year cancer battle, during which I became her primary caregiver. And I kept taking a lot of sabbaticals from my work to manage her care. And ultimately, it was touch and go there for a while. So I ended up shutting down my fund and becoming her full-time caregiver for a couple of years. Pleased to say, knock on wood, she finally had a successful outcome. And at that point, I was so obsessed with caregiving. I was like, my prior work had lost meaning and I had found new meaning. And I was like, I'm going to dedicate the rest of my life to helping caregivers.
What was it that lit your fire on caregiving?
Yeah, frankly, how much time do you have? One, I think caregiving is unbelievably unsupported, that there's a tremendous amount of pressure put on you to manage increasingly complex medical tasks and increasingly complex medical needs of somebody, whether it's a person living with dementia that's going through kind of a progressive journey, or a person living with cancer that might be going through a temporary battle for a few years or a permanent battle. You are providing minimal resources, guidance on how to manage. The respite care, by the way, is unheard of. In terms of Medicare or insurance covers nothing. So you are expected to take a lot of time to care for your loved one. That's unpaid and at the cost of your own job and your career responsibilities. I just think the whole system is almost kind of like this weirdly hidden thing where, and some estimates put out by AARP recently suggest it's over $1 trillion of hidden unpaid work is just pushed on the back of family members. But the healthcare system should and potentially could be covering some of that. And if you don't do it well, your loved one is going to have a lot of problems. So I think probably if I had to pick two things, it were respite care is unaffordable and low quality. And the private sector is completely failing at that. And it's not covered by anyone, so it's all out of pocket. And then two, you have no idea what you're doing. And caregiver training means watching YouTube videos late at night. That's kind of, and I think that given how relatively wealthy our country is, I think that both of those things should be a source of shame, but also a source of possibility in terms of innovation.
We'll talk more about this in just a moment. I'm Ron Aaron. Carol Zernial, our co-host, is here. Neal Shaw, our special guest, talking about caregiving, especially in the older population. You're listening to the award-winning Caregiver SOS on air. And Carol, you wanted to jump in.
I love hearing the passion in Neal's voice, for this topic, because it's certainly something that I think many Americans may have been lulled into. This is the way it is, without thinking, frustrated, angry, but this is the way it is, without that call to action that we need to change something. I heard you say two things. One was that this caregiving experience, it was your mother and you that were impacted originally, and then impacted again. And then you were talking about the healthcare system. And so when you look at your caregiving experience and that of others, does it really feel like a system that all the pieces are there?
Yeah, that's a great question. It's like a patchwork of a system in the sense of, I've spent years in caregiver support groups, like dementia caregiver support groups and cancer support groups. And I feel that, we actually, in a positive and negative way, I think we have some of the most cutting edge treatments, in terms of like therapeutic options, pharmaceutical medicine, surgeries, machinery, detection, screening. We have some of the best healthcare in the world in that sense. I think we have some of the not worst, but sorely lacking social care in the world. And I think so that system it's a patchwork that family caregivers are their own, but everything from how to get your loved one to and from the neurologist for their checkups, how do you get your loved one to and from chemo, who takes care of someone at home after that. I think that just all that stuff is falling on the backs of family caregivers. And I don't think there is much of a system. I think it's a very informal system that even how do you get respite care? It's like people are just kind of on their own, go to Google or open the phone book and try to figure it out yourself who's available in your local area, or post a flyer at church and hope that you can find some caregivers to help you. How do you get training? I think people do their own research, sometimes pay to attend classes in their local community college. And, I've met people who've become certified nurse aides just to learn how to care for mom or dad with dementia. And then I've met other people, such as myself, who spent hours and hours on YouTube watching a bunch of videos trying to figure it out. So I think it's a very patchwork of a system.
The video training in YouTube is one option. There's talk about what if we reimbursed. Here's the reimbursement going to the healthcare system. I realize what I'm saying, but a reimbursement code for healthcare professionals to train caregivers in these medical tasks.
I think bravo. I would welcome that. I realize that is not really being done at scale because the cost is very high. That to have a healthcare provider train a family caregiver one-on-one, would potentially break the system from a cost perspective. I actually think so. One of the projects that we've built this innovation project through an NIH grant, which it's available for free to the population, but it's called the AI Guide, and it's a AI-powered caregiver training. Before jumping directly into that, I would say where I think the opportunity now exists is using low-cost technology to personalize training for you using AI, and then delivering that to a mass scale population cheaply, because the AI system can be trained with clinicians, but it doesn't take clinician hours to deliver it to each individual person with personalization. And I think something like that can be mobilized literally at a few dollars, a month, as opposed to like a per visit clinician, and it can have infinite usage. So that's where I think that there's kind of an opportunity to bring old school knowledge combined with new age technology to operationalize caregiver training. There's 11 million dementia caregivers in the country, 6 million cancer caregivers in the country. If even an individual clinician's time might be reimbursed at $80 an hour or $100-something an hour, it's almost like would break the bank from a Medicare perspective to cover. But if you can digitize this and deliver it for a few dollars, then I think that's a fairly low cost mass scale solution that a lot of caregivers can have. The one benefit I think of digital solutions is that then the training is a coach in your pocket 24/7. And at midnight, when something is happening with your mom or dad that you don't know what to do, or at 8 p.m. on a Thursday night when this issue is happening with your spouse, you can kind of refer to the digital tool and get some guidance that I think is, sometimes the clinician's not available. So I think tools like this can be built. We're actively building them. And I think that the cost can be low, which means the impact can be large scale.
How do you train folks to interact with AI?
Great question. So actually, one of the biggest breakthroughs that we have discovered in the last 3 months, so our initial training was through AI-based chat text. Then it was through delivering fully AI-based curriculum. One of the biggest breakthroughs is voice AI. And the reason I'm mentioning that is then you don't have to train at all. So one thing that I think people in the kind of healthcare market don't appreciate is that voice AI models have gotten so good that a person can pick up a phone, even a landline, and call in, or it can call you, and you can have a natural language conversation with a human-sounding voice that is fully run off an AI system, trained on a large corpus of data. This is actually what we've mobilized, trained on a large corpus of data of how to do dementia care. And every possible situation that might come up, tasks, how to do the tasks safer, psychosocial aspects of dementia care, trained on that, and you can just have a conversation with the voice AI over a landline. So that what I like about that kind of technology is that it requires no training from the user's end, and even people in rural and lower served areas can access it.
We're going to come right back to you. A lot of those voices sound like Hal out of War Games. I'm Ron Aaron. We're talking about AI helping caregivers who really don't have the training. Neal Shaw, our special guest, Carol Zernial, our co-host, is here. You're listening to the award-winning Caregiver SOS on air.
Well, thank you so much for listening to Caregiver SOS on air. We're delighted to have you with us. We come to you every week with a discussion of an issue, a problem, some accomplishments involved in caregiving with more than 60 million caregivers across this country, but most thinking they are the Lone Rangers. We try to bring you the latest information and help that can make that job easier and more manageable. Caregiver SOS on air takes a look at trends across this country. We provide tips on how to be a better caregiver, and most importantly, where you can go for help. On Caregiver SOS on air, we try to give you what you need to make that caregiving manageable and to provide you with the help that can make your life easier. I'm Ron Aaron. Carol Zernial and I are delighted to co-host this program, and we're thrilled you've joined us on the award-winning Caregiver SOS on Air podcasts available everywhere, brought to you by WellMed Charitable Foundation.
Hello, friend. Hello, friend. Really good to see you once again. Hello, friend. Hello, friend. Really good to see you once again.
Well, thank you so much for sticking with us right here on the award-winning Caregiver SOS on air. Our podcast available wherever you listen to your podcast. We're also on the radio in several cities in Texas and Florida as well. Neal Shaw is our special guest today. We're talking about caregiving and interaction with AI, which I guess is happening more and more, whether you know it or not. Now, Carol, you had a great question for Neal.
Yeah, I was curious. I love the Yaya AI. Of course, I'm thinking Divine Sisters of the Yaya Sisterhood, Divine Secrets of the Yaya Sisterhood. But I don't know, is that why you picked it? Where did the Yaya come from?
Yeah, thanks for the question. So it has multiple meanings. I wanted something positive. So it's just like the word yeah twice, but also yaya means grandmother in Greek. Yaya also means it's the word for caregiver in Swahili and Hindi and Thai. And YAYA is an acronym for You Are Your Advocate, which I believe is like the future of self-directed tech-enabled care. So it had multiple meanings, and it was just positive to say. So that was the impetus.
And I was
It is
asking
a
you
happy sounding word.
how folks learn to interact with AI. We're doing it more than we really know.
100%. I think, and to your question about what does AI sound like, believe it or not, the AIs are getting really good. So if I have Carol, with her consent, record a 3-minute conversation, we can make a voice AI that sounds 99% close to how Carol would sound. And then if somebody's like, well, I would prefer to receive my dementia training instructions in Carol's voice, you can actually launch that. So that's kind of, I think the cool part of the technology is it's getting that good. And that breakthrough is really the last few months. And then a breakthrough on cost, where it's very, very low cost to operationalize this, literally pennies a minute. So, why not be able to do that at scale and reach people that don't even have a smartphone or a computer.
And where does the content
Curious,
come from?
With the AI though, you mentioned that taking over some people's voice, which brings up the scary things about AI. Have you had any issues with it hallucinating, dreaming, making things up that maybe perhaps you wish it wouldn't make up?
Yes. Yeah. Great questions. We've had to build in a lot of guardrails, almost to the point where it can only now guide you based on the curriculum that we've put into it. Our earlier versions of, the program, before we had kind of launched it, when we were just experimenting with it, it was going into random directions. So we've had to kind of like really narrow it. In our use case, it's pretty simple, where it's like tasks around dementia care and psychosocial aspects of dementia care. So we have a corpus of data based on, geriatric researchers at Johns Hopkins and a few other research universities that were like, only refer to this. And if it's not in here, just say, I don't know. So we're able to very narrow the use case on that. But if you don't put that guardrail in, a lot of times it just makes up stuff. And then I think that is, possible source of danger.
And you wouldn't know it's being made up.
What's that?
You wouldn't know what's being made up.
Exactly. If you were the user, as us, the builder, you would know when it veers off script and goes something in a conversation where we can reference the training data and say this was nowhere in the training data. But yeah, the user wouldn't know. And I think that's a risk when people are using the consumer models like ChatGPT or Google AI. And as the consumer who might not be a subject matter expert, a lot of times they are making stuff up. So I think people need to be wary of that.
You mentioned the voice AI. Mm-hmm. Are you already working in multiple languages? A lot of the AI can do, any old language. Are you building in multiple languages? If your curriculum, do you have to have the curriculum in the other languages, or can it do that translation?
Great question. Yeah, it can. So right now it's English is our primary, and then we are building a Spanish one. Of course, we're like looking for more. So if anyone wants to be involved, reach out to us. We're actually enrolling participants in the NIH study to give us guidance to build it better. But we are actively building in Spanish. And then over time, I think there's other languages that may need to be served. But yeah, we are building in multiple languages. And I think that's pretty straightforward. And of course, as you can imagine, like in the American Spanish speaking population, depending on what parts of the country you're in, the dementia rates are higher, than an English speaking population. And they have minimal to no support. So I think that's another very easy use case for AI to real time, personalized guidance.
And for the person who's listening, who becomes a caregiver today, who needs help, are these programs available now?
Yes. They're available now for free to consumers, and we're actively in discussions with health plans, to offer them at scale. But individuals can come to the site, yayaguide.careai.org, and just sign up. They can participate in research study or just use the programs for free. And they're constantly improving. So I think it's, and then we're working on a similar project through Duke to launch for cancer caregiving, which hopefully will roll out in the next 3 to 6 months. I have to give a big thanks to the National Institute on Aging and Johns Hopkins University. They have been very generous funders of the work so that we could give this free to individual people.
I have to give a shout. You said Johns Hopkins, and my good colleague, Jennifer Wolf at Johns Hopkins, is also on the RAISE committee. Nice. And she does fabulous work there. I hope she's involved in the project.
Nice. Yeah, it's really awesome to see. I think that caregiver support is going to be one of the biggest issues of our times. And without the support, and we've done a lot of research on it. I mean, I personally have experience with this. Within 1 year of becoming a caregiver, you have a 33% of having a major mental health challenge yourself, and a 25% chance of having physical health challenges yourself. So I do think caregiving itself is actually breaking people because there's a lack of support. And I think there's a lot we can do to improve that, by launching tools like this, by just having the caregiver have more confidence that I know what I'm doing. I'm not doing the wrong thing. If there's something that happens that I don't know, I have a resource to turn to. I think you can significantly reduce caregiver stress. So not only does it improve the care for the patient, but it actually improves the health and stress level of the caregiver. And I think that's kind of like an interesting impact. I've been thinking a lot about that caregiving should be a diagnosis by the healthcare system. I mean, like if you say your husband or wife has dementia, you should get a diagnosis that now you are a caregiver, which means you have a 25% chance you're going to have a major physical health problem. You have a higher chance of ending up in the ER yourself with your own heart issues. I think that if we treat it that way, then maybe the system would actually start thinking about the caregiver as somebody that we need to allocate funding and support to. So that's kind of one of my passion projects over time from an advocacy perspective, is to have caregivers thought of as also a patient.
I'm gonna steal that from you. I mean, we talk a lot at Raise. We talk a lot. I work in a healthcare system about the need to have the caregiver listed in the medical record, right?
Yes.
But a diagnosis as a caregiver, that is a new one, and it feels like it has more energy around that. Now you've diagnosed something. Now you have to take action on it.
Yes.
So don't be surprised if you see that pop up somewhere, and I'll totally have stolen that from you.
I would love to collaborate on that, because I think if you track the health outcomes, I think if you look at somebody who just got a dementia diagnosis or cancer diagnosis and you track the dyad health outcomes, let's just say husband and wife, I think over 1 year you will noticeably see the caregiver's own health problems resulting in higher healthcare utilizations and higher healthcare costs, and supporting the caregiver is not that expensive. So it's almost like if you think about system-wide healthcare costs, you can significantly lower that if you diagnose the caregiver as like, this is a new thing they're going to have to go through. And if I give them very simple, affordable support, I will avoid them ending up in the ER. I will avoid them having their own heart issues, their own mental health crises. I mean, it's one of the cheapest interventions you can do, in my opinion.
What kind of buy-in are you getting from PCPs who learn about Care Yaya?
Very high buy-in from PCPs, very high buy-in from, geriatrics, neurology. I think the biggest buy-in that we're working on getting is from the health plans. That's going to be a little bit of kind of like a conversation, because, I think as you alluded to, and I think as Carol alluded to, currently caregiver training is not something that is very directly thought about as being reimbursed or even being done by like the health insurance system, even by Medicare. So convincing people that, hey, this needs to be supported, this needs to be funded, this needs to be reimbursed, I think that's like a open conversation we're having, and we'd love to chat with anyone who wants to do pilots. But I think from the clinician side, I think home run, because they know the gap. And frankly, they're seeing the impact. They're seeing the impact as the caregivers get supported. The caregiver's own stress level goes down. The patient's unnecessary healthcare utilization, improves in terms of ER visits and things like that. So I think the impact is profound from like a relatively simple intervention.
So Neal Shaw, we got about 2 minutes left. Where does this go, and how do folks interact with you?
Sure. Reach out to me anytime. I'm very active on social media, LinkedIn, Instagram, Facebook, etc. So it's Neal, Neal, and middle initial K, and the last name Shaw, Shah. So reach out to me anytime. I'm happy to chat with people. I think where it goes is I would love to have a large portion of the dementia caregiver population using this or tools like this. National Institute on Aging is willing to fund projects like this, so kudos to them. But I'd really love to get it integrated into health plans, and one day get it integrated into Medicare. I do think Medicare needs to step up and support caregiver training. And frankly, the sale to Medicare is it'll lower system-wide cost. So it's a easy thing to do. And same with health systems and health plans. I think that open to collaborating with anyone. But right now, it's just directly to the people, because that's a population that we help. So yeah, I would love to collaborate with anyone.
Carol, we give you the last word.
Well, I mean, I think this has been a wonderful conversation, and it gives us a different path forward for the future. The idea that we need more training, and that it doesn't have to be one person at a time with a professional. I mean, these are solutions that scale and are inexpensive. And if we sit back and let our imagination run wild, it's a whole different future. It really is. The impact of AI across the caregiving system. Maybe someday it can be the glue that creates a real system where we don't have these holes that we fall in.
Perfect. Flat out of time. Neal Shaw, thank you so much. For Carol Zernial, I'm Ron Aaron. We thank you for joining us on the award-winning Caregiver SOS On Air.
The executive producer for Caregiver SOS On Air is Daniel Calderon. The producer is Sharice Pendleton. And the associate producer is Catherine Oglesby. We'll see you next week on Caregiver SOS On Air.
You've been listening to Caregiver SOS On Air, an exclusive presentation of the WellMed Charitable Foundation. We welcome emails with suggestions and comments on this program at radio@wellmed.net. Join co-hosts Carol Zernial and Ron Aaron next week for more on caregiving, improving the health and well-being of caregivers and their care recipients everywhere. For more on caregiving and podcasts of our programs, visit caregiversos.org.